A G-tube is a soft, flexible tube that's placed in the stomach through surgery. A G-tube is used to give a child the nutrients he or she needs to grow and develop. There are different types of G-tubes. For example, a PEG tube, a regular G-tube, or a G-tube button. No matter what type of G-tube your child has, the G-tube will require special care. Your child's G-tube site should be cleaned at least daily. A G-tube site that is kept clean and dry is less likely to have skin issues. One of the first things that you'll need to do when cleaning the G-tube is to gather your supplies. Make sure you have a nice clean surface, that you have soap and water, Q-tips, gauze, washcloths, towels, anything that you might need to help dry the area. You'll also want to have any new dressings that you use to apply to the G-tube site when it's clean. The first thing that you'll want to do before cleaning the G-tube is wash your own hands with soap and water and dry your hands completely. You'll want to talk to your child about it's time to clean the G-tube. The next thing you'll want to do is remove any old dressings that were at the G-tube site. Once you remove the dressing, you'll want to look for any redness around the tube. You'll want to move the tube, look at the skin, look for any drainage, any crusting, and look for any excess skin tissue that may have developed at the site. After the dressing has been removed, you'll want to clean the site with warm soap and water. You can use your gauze pads that are soaked with the soap and water. You can use the washcloth. You can use the Q-tips to get under the tube and remove any of the crusting or any drainage that might be there. Did that. And you'll want to rinse all the soapy water off the G-tube. You want to use any extra Q-tips that you have to, again, get in there around the edge of the G-tube and remove any of the wetness from the water that may still be under the tube. Most children with G-tubes can take a regular bath or a shower to clean around their G-tube. Be sure to check with your doctor first before doing this. If a dressing is used at the G-tube site, you can now reapply a clean, dry dressing and re-secure the G-tube. Do not use ointments around the G-tube site unless directed by your doctor. Remember to call your child's doctor if the G-tube site is red, swollen, is sore, has excess skin at the site, or is leaking from or around the G-tube.